Now this is where they join or try to join a medical, and it starts. As a junior who has to prove the medical that it was worth the time, who they have spent years of knowledge pounded with and given the time to raise as a medical professional. Starting with the gratitude to all with a smile on the face at all times. Double shifts might be turned to be even full day and night, have to keep the smile on the face. Hiding all the tiredness even after doing all the task given. Learning and gaining as many more experiences that they hadn't been able to get in the medical colleges. Yes, it's not possible to get all the experiences in colleges as being a student. It is unorthodox to let who is just starting to learn to be allowed to apply the knowledge practically on all areas, except few minor cases that might not cause bigger incident. After few years of continuing the trend, finally becoming a medical employee who is now respected and known as one who respects, days in the medical starts with a proper schedule. But on call at all times of the day and night. When a call comes from the medical, it's time to reach there as soon as possible, leaving anything they were doing as it was. But it does have its perks, as the salary is counted per hour of work they put in the medical. Each day in the medical they learn new things as they see different types of cases coming in the medical, e.g. how does a child end up having a pencil nip stuck inside his sinuses? Or why would a man put his fingers in a screw nuts just to get it stuck inside? It's unbelievable how a mind of the patients works. Different patients with different cases. It is serious but is hilarious at the same time with the accidental cases. Keeping the laughter from coming out is so hard while dealing with the patient. But somehow manages to do it and solve the case. The nature, on the other hand, is way too bizarre. From the ancient times, the dawn of civilization, people have used medicine or herbs to cure the disease, cases or abnormalities in the health. The nature throws the people into peril but also gives out the cure too. The process of scientific discovery often involves formulating hypotheses, testing predictions, and an interdisciplinary search. In the real world, searchers for truth cannot afford to remain confined to a single discipline. Flax golden tales, scientific inquiry, invention and test 1. Finding out what had caused the illness, brainstorming the possibilities and testing them out is a regular practice that medical employee does on a more or less daily basis, as each of illness can be different from patient to patient. From a small illness to an epidemic that might endanger everyone, the process to follow is the same. From curing the small fever to saving people from their deaths, it's all part of the process. Finding out the past history of the medical is intriguing, as it was once known as sorcery or magic. More fun is added as they use the dialect as a magician or sorcerer to children when they come for treatments. It makes them happy, and the smile from them makes all the hard work worth the time and knowledge. It's so fulfilling to see the patient smiling and recovering and moving around along with the family. When a new type of treatment is successful, medical employees also enjoy the happiness the patients, their family and friends are having. Laughing and smiling that they have taken one more step in the medical, step in health, and new way to help the patient. It's recorded, all process explained, and share with other medical employees from all locations, so if there is any cases which needs the new treatment, gets it as soon as possible. A perk of having internet and a modernized world. Not all day is happy. Medical life has its ups and downs. Not all illness are curable. Still they still try their best, hoping that this will work. Even if this option can give the patients 1% more chance at the survival, they will try it. Brainstorm and test again and again. It might have been too late for the patient, but still giving them hope. Hope for the future which might not happen, but still smiling and giving the best as they can, hiding the fear inside. Failed the patient. Heartbreak, but still hoping that next patient of the same type of case will be better treated, as there had been many tests for the treatment and is better than treatments before it. Failing is not the hardest part at all. It's the part where they have to face the family of the patient. Looking at them head on and saying that they failed to keep the promise and let a life of their loved ones slip through. The curses and the cries, every time it stings in heart to see, but they have to bear with it so that there can be better future for others. They begin to question themselves, if they are doing enough, is it worth to continue the work that they have been doing? Looking for someone to confide into, family. Looking for a way to share the what had occurred but cannot share as they had taken the oath code of ethics. Thinking of giving up. Uneasiness just doesn't go away. Having the mind start go blank everywhere. Unable to think, unable to do anything. Feeling dull. Loved ones try to confide and says to remember the ones that they had succeeded. To try and look to the positive side and learn from the negative sides. According to Brian Tracy, the future belongs to the competent. Get good, get better, be the best. Blog Brain Tracy. Learning that, they take new hope and belief in themselves. Hoping to grasp the new future for themselves and to give new hopes to others. And starts to move forward in their life.